Hey everyone, and welcome back to the channel. Today we're tackling a topic that's incredibly relevant, yet often flies under the radar: vitamin D deficiency. You might think of vitamin D as just another letter in the vitamin alphabet, or maybe something you only need to worry about if you live in a perpetually cloudy place. But the truth is, this isn't just about strong bones. It's about your overall well-being, from your immune system to your mood and even your heart health. We often associate deficiencies with rare conditions, but this one is surprisingly widespread, affecting a significant portion of the population globally. Understanding its impact is the first step towards safeguarding your health. Vitamin D deficiency is more common than you might think, and it can have serious consequences for your health. Let's dive into the disadvantages and health problems caused by a lack of this essential vitamin. We're going to explore how a shortfall in this crucial nutrient can manifest in various ways, some subtle, others more pronounced, and discuss why it's often called the sunshine vitamin, and what happens when we don't get enough of that metaphorical or literal sunshine in our lives. This isn't just about listing problems, it's about empowering you with knowledge so you can recognize potential signs and understand the importance of maintaining healthy levels. Throughout this video, we'll break down the science in an easy-to-understand way, explore the different conditions linked to low vitamin D, and, importantly, discuss how you can ensure you're getting enough. We'll cover everything from how it affects children to its impact on adults, and even touch upon how it interacts with various systems in your body. So grab a, hopefully vitamin D fortified drink, get comfortable, and let's get into the nitty-gritty of vitamin D and why it deserves a prime spot on your health checklist. This is information that truly everyone needs to know. First up, let's talk about a condition that primarily affects children: rickets. This isn't some archaic disease from old textbooks. It's a very real consequence of severe vitamin D deficiency in growing bodies. Vitamin D plays a critical role in calcium and phosphorus absorption, which are the building blocks for strong, healthy bones. When a child doesn't have enough vitamin D, their body cannot properly absorb these minerals from their diet. As a result, their bones don't mineralize correctly, leading to them becoming soft, weak, and susceptible to deformities. Think of it like trying to build a house with wet cement. The structure just won't be sound. The signs of rickets can be quite distressing and can have long-term implications if not addressed promptly. We might see bowed legs or knock knees as the soft leg bones bend under the child's weight. Other signs include thickened wrists and ankles, a delayed fontanelle, soft spot, closure in infants, bone pain, and even dental problems like delayed tooth formation or defects in tooth enamel. Muscle weakness and impaired growth are also common. It's a stark reminder of how crucial this vitamin is right from the earliest stages of life, ensuring that children have the foundation for a healthy skeletal structure as they grow and develop. Now, while rickets affects children, adults aren't immune to the skeletal problems caused by vitamin D deficiency. In adults, this condition is known as osteomalacia, which literally means soft bones. Similar to rickets, osteomalacia occurs when there's a defect in the bone-building process. Even though adult bones have stopped growing in length, they are constantly undergoing a process of remodeling. Old bone is broken down and new bone is formed. Vitamin D is essential for this mineralization of the new bone matrix. Without enough vitamin D, this process is impaired, and bones become soft and weak, rather than strong and resilient. The symptoms of osteomalacia can be somewhat insidious and often mistaken for other conditions like arthritis or general fatigue. Individuals might experience diffuse bone pain, particularly in the hips, lower back, and legs. Muscle weakness is also a common complaint, which can lead to difficulty walking or climbing stairs and an increased risk of falls. Unlike osteoporosis, which we'll discuss next, where bones become brittle, in osteomalacia, the problem is more about the bones not hardening properly, making them tender and prone to aching. This can significantly impact a person's quality of life and mobility if not diagnosed and treated. Moving on to another significant bone health issue linked to vitamin D, osteoporosis. While osteomalacia is about soft bones, osteoporosis is characterized by bones becoming porous and brittle, essentially losing their density and structural integrity. This makes them incredibly fragile and susceptible to fractures, even from minor stresses like bending over or coughing. Vitamin D plays a crucial role here because it's vital for calcium absorption. If you're not getting enough vitamin D, your body can't effectively absorb calcium from your diet, and calcium is the primary mineral that gives bones their strength and density. It's a 1-2 punch to your skeletal health if both are lacking. Osteoporosis is often called a silent disease because there are typically no symptoms in the early stages. Many people don't even know they have it until they suffer a fracture. These fractures most commonly occur in the hip, spine, and wrist, and can lead to chronic pain, disability, and a loss of independence, especially in older adults. While it's more prevalent in postmenopausal women, men are also at risk. Maintaining adequate vitamin D levels throughout life, alongside sufficient calcium intake and weight-bearing exercise, is a key strategy in preserving bone density and reducing the risk of developing this debilitating condition later in life. Beyond bone health, vitamin D is a powerhouse for your immune system. Many people are surprised to learn that vitamin D receptors are found on numerous immune cells, including T cells, B cells, and antigen-presenting cells. This indicates that vitamin D plays a direct role in modulating both the innate and adaptive immune responses. It helps to regulate the production of antimicrobial peptides, which are like natural antibiotics that can fight off invading pathogens. It also helps to keep inflammation in check, preventing an overactive immune response that can sometimes be harmful to the body. Think of it as a conductor for your immune orchestra, ensuring all the players are working in harmony. When you're deficient in vitamin D, this carefully orchestrated immune response can falter. Your body may become less effective at fighting off infections, making you more susceptible to common illnesses like colds, the flu, and other respiratory infections. Some research even suggests a link between low vitamin D levels and an increased risk of autoimmune diseases, where the immune system mistakenly attacks the body's own tissues. So, ensuring adequate vitamin D isn't just about avoiding a sniffle here and there. It's about maintaining a robust and balanced immune system that can protect you from a wide range of threats and keep chronic inflammation at bay. The connection between our physical health and mental well-being is undeniable, and vitamin D appears to play a role here too. There's growing evidence suggesting a link between low levels of vitamin D and an increased risk of mood disorders, including depression and seasonal affective disorder, which is a type of depression related to changes in seasons. While the exact mechanisms are still being researched, it's known that vitamin D receptors are present in areas of the brain that are involved in mood regulation, such as the hypothalamus and the prefrontal cortex. This suggests a direct biological pathway through which vitamin D could influence our mental state. Some studies have found that individuals with depression often have lower vitamin D levels compared to those without depression. Furthermore, some, though not all, intervention studies have shown that supplementing with vitamin D can lead to improvements in mood symptoms in people who are deficient. It's thought that vitamin D might affect the production of neurotransmitters like serotonin, which is crucial for mood balance. It may also help reduce inflammation, which has been implicated in the development of depression. While vitamin D isn't a standalone cure for depression, ensuring adequate levels could be an important complementary strategy for supporting overall mental health and emotional resilience. Do you find yourself feeling overwhelmingly tired day in and day out, even after getting what seems like enough sleep? This kind of persistent, debilitating fatigue can have many causes, but vitamin D deficiency is one that's often overlooked. While it might not be the first thing your doctor checks for when you complain of tiredness, there's a significant body of evidence linking low vitamin D levels to symptoms of fatigue and a general loss of energy. This isn't just feeling a bit sleepy in the afternoon, it's a more profound lack of vitality that can significantly impact your daily life, productivity, and overall quality of life. The exact reasons why vitamin D deficiency can lead to fatigue aren't fully understood, but there are several plausible theories. It could be related to its role in muscle function. Weak muscles can certainly contribute to a feeling of tiredness. It might also be linked to its influence on mitochondrial function, the powerhouses of our cells, or its role in reducing inflammation, as chronic inflammation is often associated with fatigue. Some studies have shown that correcting a vitamin D deficiency can lead to a noticeable improvement in energy levels for many individuals. So, if unexplained fatigue is dragging you down, it's definitely worth considering whether your vitamin D status could be a contributing factor. Chapter 7: Heart Health and Vitamin D. Exploring the connection. Our cardiovascular system is incredibly complex, and maintaining its health is paramount. Emerging research has begun to highlight a potential connection between vitamin D levels and heart health. Several observational studies have found an association between low vitamin D status and an increased risk of various cardiovascular problems, including hypertension, heart attacks, strokes, and heart failure. While association doesn't equal causation, these findings are compelling enough to warrant further investigation and consideration in our overall approach to heart disease prevention. The mechanisms are thought to be multifaceted. Vitamin D may influence heart health through several pathways. It's known to play a role in regulating blood pressure by affecting the renin-angiotensin-aldosterone system, a key hormonal system involved in blood pressure control. It also has anti-inflammatory properties, and chronic inflammation is a known contributor to atherosclerosis, the hardening and narrowing of arteries. Furthermore, vitamin D may help improve endothelial function, which is the health of the lining of our blood vessels. While more definitive clinical trial data is needed to establish a direct causal link and the benefits of supplementation for heart disease prevention, maintaining adequate vitamin D levels is increasingly seen as a piece of the puzzle for supporting a healthy heart. The health of our gut is foundational to our overall well-being, influencing everything from nutrient absorption to immune function. Interestingly, vitamin D appears to have a significant impact on the gut environment as well. The cells lining our intestines have vitamin D receptors, suggesting that this vitamin plays a direct role in maintaining gut barrier integrity. A strong gut barrier is crucial for preventing harmful substances, like toxins and undigested food particles, from leaking into the bloodstream, a phenomenon often referred to as leaky gut, which can trigger inflammation and immune reactions throughout the body. Furthermore, vitamin D is involved in modulating the immune system within the gut, which is a major hub of immune activity. It helps to regulate the balance of pro-inflammatory and anti-inflammatory responses in the gut lining. Some research suggests that vitamin D deficiency might make individuals more susceptible to inflammatory bowel diseases like Crohn's disease and ulcerative colitis, or exacerbate their symptoms. There's also emerging evidence linking vitamin D status to the development or severity of certain food allergies, possibly due to its influence on immune tolerance. Maintaining good vitamin D levels could therefore be an important factor in supporting a healthy gut and a balanced immune response to what we consume. Beyond the specific conditions of rickets and osteomalacia, a more generalized sense of bodily weakness, including diffuse bone pain and muscle soreness, can be a hallmark of vitamin D deficiency. This isn't always sharp, localized pain, but can often manifest as a dull, persistent ache that's hard to pinpoint. Many people might attribute these symptoms to just getting older, overexertion, or stress, without realizing that a simple nutrient deficiency could be the underlying cause. The discomfort can be widespread, affecting the back, pelvis, ribs, and legs, making everyday activities uncomfortable. The muscle weakness associated with vitamin D deficiency can also be quite significant. You might find it harder to get up from a chair, climb stairs, or even lift objects that you previously handled with ease. This weakness can also contribute to an increased risk of falls, especially in older adults, which, when combined with potentially compromised bone health, can lead to serious injuries like fractures. The pain and weakness are thought to stem from the direct effects of vitamin D on muscle tissue. Receptors for vitamin D are found in muscle cells, and its role in calcium metabolism, which is also essential for muscle contraction and function. Addressing the deficiency often leads to a noticeable improvement in these symptoms. So, we've talked a lot about the problems, but what about the solutions? How can we prevent vitamin D deficiency and ensure we're getting enough of this vital nutrient? The good news is that there are several effective strategies. The most natural way is through sensible sunlight exposure. Our skin produces vitamin D when it's exposed to UVB rays from the sun. Aiming for about 10 to 30 minutes of midday sun exposure on your arms and legs a few times a week can be sufficient for many people depending on skin type, location, and time of year. However, it's crucial to balance this with sun safety to avoid skin damage. Dietary sources are another important avenue. Fatty fish like salmon, mackerel, and sardines are excellent natural sources. Egg yolks and beef liver also contain some vitamin D. Many foods are also fortified with vitamin D, such as milk, yogurt, orange juice, and breakfast cereals. So check those labels. For many, especially those with limited sun exposure, darker skin tones, or certain medical conditions, supplementation may be necessary. It's best to get your levels checked by a doctor to determine if you need a supplement and what dosage is appropriate. Finally, regular physical activity, particularly weight-bearing exercise, not only supports bone health directly, but can also encourage more time outdoors, indirectly helping with vitamin D synthesis. We've covered a lot of ground today, from the ways vitamin D deficiency can impact our bones in childhood and adulthood, to its effects on our immune system, mood, energy levels, and even our heart and gut health. It's clear that this sunshine vitamin plays a far more extensive role in our overall well-being than many of us realize. The key takeaway is that being mindful of your vitamin D status is an important part of proactive health management. Recognizing the potential signs and understanding the risk factors can empower you to take the necessary steps. The prevalence of vitamin D deficiency is a global health concern, but it's one that we can address. By combining sensible sun exposure, a diet rich in vitamin D or fortified foods, and when necessary, appropriate supplementation under medical guidance, we can work towards optimizing our levels. Remember, the information we've discussed is for educational purposes, and individual needs can vary greatly. It's not just about avoiding disease, it's about promoting vitality and resilience across all systems of your body. For more information about vitamin D deficiency and to get advice tailored to your health conditions, it is best to consult your doctor or a nutritionist. They can assess your individual risk factors, order a blood test if needed, and recommend the best course of action for you. Stay healthy and take care of your vitamin D levels. Thanks for watching. Don't forget to like, subscribe, and hit that notification bell for more health insights. Stay curious, and I'll see you in the next video.